If you've ever been told, MRI looks normal, there's nothing wrong, or the opposite, your spine is full of degeneration, no wonder you're in pain. Today's video will change how you see your body. Welcome back to NxHLife, where chronic pain sufferers rise as pain warriors and learn to take back control. I'm Antony Lung, physiotherapist, nutritionist, and functional medicine practitioner. Let's uncover why your scan doesn't always match your symptoms, how pain can exist without damage, and damage can exist without pain, and what the new science is revealing about how your body actually heals. MRIs are one of the most overused and misunderstood tools in the modern healthcare, same as X-ray. They are brilliant for spotting tumors, fractures, or acute injuries. But when it comes to chronic pain, they tell only a fraction of the story. Studies show that up to 80% of people with no pain at all have abnormal findings in MRI X-ray, like disc bulge, arthritis, or labral tears. And on the flip side, many people in severe pain have perfectly clear scan. Yet, our system still treats the image as the truth and the patient as the mystery. I remember early in practice, patients would bring scans like criminal evidence, circling the words of degenerations as if it meant a lifetime sentence. But what they weren't told is that most of those findings are simply part of being human, not necessarily part of the problem. I've seen countless patients who have had surgery to fix what the scans show, only to find that the pain unchanged, or even worse. Often, the structure on the image isn't the real source of pain. The body compensates, adapts, nerves get hypersensitive, movement pattern shifts. Pain can be referred from other tissues, hip issues showing up as a back pain, gut inflammation presenting as pelvic pain, even emotional stress tightening muscles that trap nerves. The scan can't see your breathing pattern, your sleep depths, your trauma history, or even your stress hormones. So, when you treat only the visible lesion, you might silence the noise, but not the conductor. Pain isn't simply a message of damage. It's your body's protective alarm system. When the brain believes there's a threat, it creates pain to get your attention, even if the tissue has already healed. That's why chronic pain is less about what's broken and more about what's stuck in alarm mode. Neuroscience calls this central sensitization. Functional medicine calls it system dysregulation. Both mean the similar thing. Your alarm switch is jammed on. And just like a smoke alarm, you don't fix the sound by smashing the sensor. You calm the fire. Here's what your scan can't see. Neuroinflammation when your immune system keeps nerve irritated long after injury. Gut health imbalance that raise systematic inflammation and pain sensitivity. Hormone stress and sleep disruption. Low melatonin, high cortisol, low recovery. Movement and posture patterns, subtle coordination errors, and MRI will never detect. Fear and beliefs. If the brain predicts danger, it keeps the pain signal alive. All of these factors shape the volume knob of your pain experience. You might be wondering, but is there real science behind this? Absolutely. The newest research shows pain is not about structure, it's about system. For example, 2021 study in JAMA Psychiatry tests pain reprocessing therapy, teaching people with chronic back pain to reinterpret pain signals as safe instead of dangerous. After 4 weeks, 2/3 of participants become pain-free without drugs or surgery. Their MRIs didn't change. Their sense of safety. Or another review in 2022 in Frontier of Pain Research found that gut dysbiosis and chronic inflammation amplify nerve sensitivity and central pain signaling. When clinicians restore gut balance, improve nutrition, and reduce inflammation triggers, pain score dropped dramatically, even though nothing visible changed on the scan. These two areas, mind-based neuroplasticity and biological system regulation, prove that healing doesn't start with imaging. It starts with retraining your nervous system and rebuilding your internal environment. The scan shows structure. Your body's story runs much deeper. So, what do you do when your scan doesn't tell the whole story? You start building your pain story timeline, mapping where symptoms begin, what events, stresses, or illnesses surround them. That timelines reveal hidden patterns MRI can't. Then we match your story to the 7 layers of Pain to Peace blueprint. Mindset Mastery, Pain Science 101, the science of taking back control. Seeing clearly, red flags and paths to the right treatments, beyond biology, the psychosocial roots of pain. Your pain story, your biology, functional medicine foundation. Science, self, and strategy, choosing the right treatments for you. And your healing blueprint, plan, reflect, and adjust. That's the real roadmap. Not more scans, but deeper self-understanding. Your MRI is a snapshot of anatomy, not a mirror of pain. If this video helped you see your body differently, hit like, subscribe, and drop a fire emoji in the comments to show you're ready to rise as a pain warrior. And if you want to go deeper, grab our free guide, 7 Unspoken Truths About Chronic Pain Your Doctor Won't Tell You, or join the 5 Days Pain Challenge. They will show you exactly how to start calming your nervous system and rebuilding from the inside. I'm Antony Lung, and together, let's turn pain into peace one step at a time. See you next time.